Taking a wider perspective, perhaps, what are the opportunities for pharmacists in respiratory medicine?
Let's first think about perhaps the role of pharmacists in respiratory, because I think that's really important for us to consider. And I think working in respiratory and working with respiratory patients is a very enjoyable environment to work in. The MDT are often very welcoming to having pharmacists involved, which is always a good starting point. I think there's opportunities across the whole spectrum of where a pharmacist can work. So, we know that community pharmacists have a vital role in supporting people with respiratory disease. So, this is supported with the new medicine service. We very much will help support community pharmacists in health promotion, so stop smoking services, exercise, weight reduction, and we hope to have a new contract which encourages community pharmacists to support more with inhaler technique, because of course for them to check and optimize inhaler technique when a patient collects their inhalers is the best time for that to happen. So, and I think pharmacists are well placed and well educated to do that.
And are there other things they could do as well?
The other area I haven't mentioned is around red flags. What about those patients coming into community pharmacists who are picking up frequent courses of antibiotics and steroids but haven't yet got a diagnosis? Patients who are coming in for cough medicines, and it could be lung cancer, or it could be COPD, or indeed could be asthma. Those type of red flags, we can actually help pharmacists to identify and then to refer through to the GP, practice nurses, and so on for diagnosis. And then, of course, we've got GP, pharmacists working in GP practices. Fantastic opportunities for pharmacists within respiratory care here. Structured medication reviews. So many of our patients are on inhalers and they're held medication. So again, making sure how they use it, when they use it. There's obviously a big push at the moment with the NHS agenda to become carbon neutral. So there's incentives for GP practices to look at using greener inhalers, such as dry powder inhalers, and a lot of GP practice pharmacists are getting involved at the moment with that piece of work. There's also a massive backlog of patients with asthma and COPD that have not been reviewed because of COVID, and a lot of GP practice-based pharmacists are in a very exciting opportunity for them to grasp and take and work with their surgeries and their nurses, GPs, to help review some of those patients. So massive opportunity within primary care.
That's interesting. And previously you've mentioned there are other roles too.
Opportunities in hospital, so specialist commissioning for all these high cost therapies like the biologics we talked about. Really important to have pharmacists involved in providing those services, working on the wards. And the last area is integrated care, so pharmacists working across the integrated care system, trying to break down the barriers between primary, secondary care, community hospitals, councils, to try and improve health and prescribing of respiratory care across the whole integrated care system that they're working in. So huge opportunities for pharmacists within respiratory.